Today we're going to talk a little bit about ADHD, which is a condition affecting thousands of children in our society, and the number of children being affected is growing exponentially. Now, ADD stands for Attention Deficit Disorder, and ADHD stands for Attention Deficit Hyperactivity Disorder. Often individuals with ADD go unnoticed and undiagnosed due to the fact that they do not act out. Consequently, in a school setting, the teacher may just assume that the student is lazy. However, with ADHD, the student is acting out or will not sit still or cannot leave other students alone, etc. In these types of cases, in this case, the acting out usually leads to a diagnosis. So the diagnosis of ADHD should be given based on a collection of data from parents, teachers, and school administrators through questionnaires. Unfortunately, this is rarely how the individual is diagnosed. Therefore, it is not uncommon for students to be diagnosed incorrectly with ADHD based solely on the fact that they're difficult to control, or they seem to not be able to follow instructions. Now, treatment of ADD and ADHD almost always involves the administration of a psychostimulant drug. This is often effective in reducing students' inability to sit still and focus. The effect of this drug, however, is temporary. It only works when it is in their system, but even more importantly to note is that eventually it won't work at all. ADD and ADHD are not conditions that only affect children either. In other words, a person with this disorder will not grow out of it. So while we see benefit from the drugs used to treat ADD and ADHD for a few years, eventually they'll be left on their own to deal with the effect of this disorder. Now, you may find it interesting that a stimulant drug is used to treat a person with hyperactivity. The reason for this will come clear as I explain the brainwave dysregulations associated with this condition. Mark Steinberg, PhD, said, quote, "The essential common denominator that characterizes all ADD and ADHD and that manifests in such a variety of seemingly disparate symptoms and diagnosis is dysregulation," end quote. So there's a study that was published in the Neuropsychology in 2001, volume 15, number 1, pages 136 to 144, found that QEEG, which stands for qualitative electroencephalogram, had a 90% sensitivity and a 94% specificity for identifying brainwave dysregulation associated with ADHD. Now, typically, an individual with ADHD will show a delta theta dysregulation on their qualitative electroencephalogram, or QEEG. This indicates that the person is stuck in the slowest wavelength patterns of the brain. They are, in fact, operating in a sleep state most of the time. This explains the acting out that occurs, as this is a natural reaction of the body attempting to arouse the brain. Now, how many of us have done the same thing while driving? We become drowsy and start playing loud music, rolling down windows, even going so far as to slap ourselves to try to wake up and pay attention. Imagine being in that state all of the time and trying to go to school or work. Typically, an individual with ADD will show a cognitive dysregulation. Basically, this is dysregulation of the interconnectivity of the different regions of the brain, thereby interfering with the brain's ability to process stimuli. This is why an individual with ADD will have a hard time paying attention even though they're not fully awake. Or they are fully awake, I'm sorry. They do not act out because they're not trying to arouse their brain. It is not too uncommon for an individual who has been diagnosed with ADHD to present with a beta dysregulation. Basically, this individual has been misdiagnosed. What was thought to be ADHD is actually an anxiety disorder. If they had tried to correct the behavior with medication, they will most often report that the medication was ineffective. So the best way to find out if it's ADHD or ADD is to do that QEEG and find out what the dysregulations are. And then using neurofeedback therapy, you can correct those dysregulations. And that correction is permanent. Thank you.